Hey guys, waiting for the stream to go live, and today's class is a really special class, and I'm assuring you that today's class is going to be useful for you. Okay, and I'll give you before I start, I have one or two things to say. The first thing is that first of all, you should definitely watch this video in its entirety if you were understanding the concepts of adrenergic receptors for the first time. Okay, and if you're re-watching this video or if you come here for the trick or the whole thing again, I will be summarizing that. I will be summarizing that again, right? At the end of this video. Okay. So I will spend around half an hour in explaining all the concepts in this video, and then at the end I will give you a 3-minute summary of all the concepts that I have explained in this video, right? So if you're here for a quick recap, I will be doing that at the end. So you can skip to the end of this video for that, right? So I'm going to begin in another minute. Let me just put it on my Telegram channel, that is at the rate NEET PG Chetanya. You can join my Telegram channel, and you can stay updated with my classes. So I'm taking a class after a pretty long time. Yeah. So, welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, their NEET PG division, where you have the top educators, you'll have quality content, and today's content you will find is unique. You will not find it anywhere else, and that is why you will also have a great learning experience, right? So, first coming to who am I? My name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, AIMS, New Delhi, India's best medical college. My UG rank was 4 my in the AIMS examination, and my UG rank in the JIPPER examination was 5. Okay, and I had a good rank in the NEET, the KVPY, and NTSC. Okay, so today's class, as I've already told you, as you've already seen from the thumbnail and the title, is going to be about adrenergic receptors, mainly their functions. All right, mainly related to their functions. I will go a little bit into the details of how they work, but for that you need to know about what are G protein coupled receptors. If you have to understand that, GPCRs. But I will tell you without any other understanding on how to remember all of these functions, how to remember exactly which kind of receptor mediates what kind of function, and why this is important, because it helps you correlate what does an alpha receptor do and what does a beta receptor do, and that is very important when it comes that forms a basis of your physiological understanding. And then when you come to pharmacology, you talk about alpha blockers and beta blockers. This will again be very important, right? So these are the 5 cartoons we'll be taking. So I hope you can identify which all are these 5 cartoons, right? This one you might not be able to identify. I'll be coming to that, right? So let's start. Before I go into this video, I'll be telling you a little bit about Unacademy and their NEET PG program. So as you can see here, there are a few courses that are shown, and all of these courses, as you can see, are locked. So for example, this foundation course for NEET PG part 1, there's a capsule course on medical research, right? There's a course on clinical MCQs and physiology. So all of these courses are available on Unacademy Plus, right? And all of this content has been specially curated for you by the top educators and in line with the latest pattern. Okay, as you all know that this year there is a common entrance for all the central institutes, right? So this is the name of the examination. So you have to be updated with whatever is going on. Okay. So this is the about the Unacademy Plus courses here, and all of these are logged courses. So whenever you take the Plus subscription, you will be able to access these courses. Now there are a few special classes on Unacademy. I have also taken a few classes. Like I had taken a class on arteries of upper limb. You can go watch that class. Download the Unacademy Learning app. Go to my profile. Uh, First hit the follow button, and then you can watch this video. It is a free video, so all of these videos, like for example, you have discussions on various aspects in whatever the teachers are teaching. So you have approach based videos, you have some MCQ based videos, and then you have some theoretical videos. So all of these videos are available free of cost. So even if you don't take an Unacademy Plus subscription, I would ask you to download the Unacademy Learning app, so that even if you don't watch it regularly, if you come across some video that you feel might be something helpful, like for example this video, I know this video is definitely going to be useful for you, and so you might come across such content frequently on Unacademy, right? And the other advantage is that you can give here free mock tests, absolutely free of cost. And if you have taken the Plus subscription, there are additional mock tests that you can give, which are more structured and will be much more helpful to you, right? Which will be covering your syllabus pretty comprehensively. So as you all know that हम MBBS student हैं, we have very busy lifestyles. So the benefit of Unacademy Plus is that you get a flexible schedule. You can learn at your own convenience in the language of your choice. Okay? Because you can also see that there are teachers who are teaching in Malayalam, who are teaching in Tamil. So the best thing is not that it's not just English or Hindi. You can learn in whatever language you have to learn, and you will have unlimited practice here. Okay? Because as I already told you, if you've taken the Plus subscription, there are so many mock tests for you to attempt. You will not need anything else. And then because this is such a interactive platform, I have opened the live stream on my mobile phone. I can read your chat, you all can say hello, and you can definitely chat with me here. And because of that, I will keep the class interactive. I will keep asking you guys, and that is how you can learn anywhere you want, and just with your mobile phones. All you have to do is download the Unacademy app, and all of these videos you can stream on YouTube. Hi Priya Sharma. Right. So about the NEET PG subscription, there are a few plans here, and the plan that I usually recommend to people is either the 1 year or the 2 year. And if you are in the second year right now and you're very confident that you have to be very clear with your goal, then you can also take the 3 year plan. I'll just come to the pricing after this slide. Before that, I have to tell you here about something known as the referral code. Alright, so here is an option to enter referral code where you have to write only one thing, Chetanya 10. That is the only referral code you will need for you or for any of your knowns, right? If you write this referral code, click apply, okay, you will get a 10% off straight away. Okay, then if you contact me, so recently someone contacted me for their brother's subscription, okay, and that was a 50,000 subscription, and in that I had given them a 4,000 rupees extra cashback from my side because they had contacted me personally for it. They had told me that there is some problem with their condition, they had to take a loan, so I had given this extra cashback also. Yeah, so this is my Instagram ID at the rate chetanya.blue, or you can join my Telegram channel, that is at the rate NEET PG Chetanya, and there you can contact me on our discussion group. If you are planning to take an Unacademy Plus subscription, you will get this extra 10% off. You will be able to use these credits. Alright, I will tell you how to apply these credits, and besides that I will also give you some additional cashback from my end, right? So it will be a very good deal for you if you use my referral code for any Unacademy Plus subscription. Alright, all you have to do is click apply. देखो यहाँ पे सीधा 10% discount लग गया, 40,000 से 36,000 हो गया, and that is how you go about this, right? So next thing that I wanted to talk to you about, okay, hi Priya, hi Purvi, hi Roshan. Next thing I wanted to talk to you about was the iconic subscription, right? So the benefit of the iconic subscription is much more than the plus subscription. Okay, let's compare. If you talk about 12 months, this is let's talk about 3 years. Let's compare 3 year to 3 year. Okay, so this is 36 months, this is costing you 45,000. This is 36 months, this is costing you 82,800. And what you get in the NEET PG iconic subscription, you not only get Unacademy Plus, you also get Prep Ladder. You get everything that is there in the Prep Ladder app. So Prep Ladder, as you already know, Unacademy is already India's largest online learning platform, and they have acquired Prep Ladder, which is a very established leader in medical education. So Prep Ladder का आप ये subscription ले लोगे, तो Prep Ladder लिया तो इसमें you get all the question banks here, and you get all the videos here, and there are a lot of top educators teaching here. Like for pharma, for ortho, you have ortho ka dhoom dhadaka there, and GRG sir who teaches pharma in a very creative way, right? So, and I would personally recommend that you watch these videos on Prep Ladder. So the benefit of the iconic subscription is that you get the best of Prep Ladder, which is already a 50,000 subscription for 3 years. Okay, 3 years के लिए 82,800. If you talk about UG coachings, it used to be 1 lakh for 1 year offline coachings, but now this is 82,800 for 3 years. And again, this is with using my referral code, where you're already getting a 10% off, that is around 9,000, and I'll obviously give you some more cashback from my side. Okay, so you can definitely take the iconic subscription where you get the best of both worlds, Unacademy Plus and Prep Ladder. This is the pricing for the general Unacademy Plus course. Take either the 1 year or the 2 year course depending on how much time is left in your appearing in the examination. Okay. So now I'm going to move to today's topic, that is adrenergic receptors and their functions. Okay. So I had shown you in the first slide that we'll be talking about adrenergic receptors. Okay. So let's do this. So see, this is essentially the summary slide. This is the slide that I want you to know at the end of this lesson. Okay? And I have handwritten this slide. I have handwritten this concept. So if there is anything you feel that there is wrong, all right, you let me know. And I assure you कि इससे you will be able to remember everything very easily. And this is a purely my creation, and this is a completely unique and innovative concept. So first, let's talk about who these two people are. Okay, can anybody in the chat tell me who these two cartoon characters are? I'm sure you know who these are. I can see Aditi is here, Purvi is here, Priya is here, and Roshan. These four people are there. Then there are four more people. So this very easy question: who these cartoon characters are? Yeah, I'm sure you will be at least be able to identify this yellow-haired person. Jaldi, jaldi, we don't have so much time. Like I said, for those people who have come here for revising this video, you just skip to the end. Just skip to the end where I'll be recapping the whole thing. Alright, I will be summarizing everything using this slide, and that way you will be able to remember everything and in one go. So right now, yes, singer Smetty Vishnu has said right, this is Johnny Bravo, right? This is Johnny Bravo. Now what is the characteristic of Johnny Bravo? Johnny Bravo is muscular, right? Muscular, popular, spectacular, सब कुछ, ठीक है? So that is the thing about Johnny Bravo. Johnny Bravo is very muscular. So what do muscular people usually do? ठीक है, मिर्जापुर में मिस्टर पूर्वांचल बनने के लिए वो क्या करते हैं? फ्लेक्स करते रहते हैं, right? So to flex is essentially muscle contraction. And what does muscle contraction need? Calcium, right? So remember Johnny Bravo, he loves to flex. He loves to flex. So that is about Johnny Bravo. Just remember this thing. ठीक है, अभी जब मैं कॉन्सेप्ट पे आऊंगा तब बताऊंगा इसको कैसे इसमें घुसाना है. ठीक है, उसके बाद सेकंड कैरेक्टर, दिस वन यू प्रोबेबली वोंट नो, आई डोंट एक्सपेक्ट यू टू नो. दिस कैरेक्टर्स नेम इज मैंडार्क. अगर बचपन में कार्टून बहुत सीरियसली देखे हो तो याद होगा. मैंडार्क वाज इन द सीरीज डेक्स्टर. रिमेंबर देयर वाज अ cartoon character Dexter who had this laboratory in his underground basement. There was this sister जिसको उसके बारे में उसके साथ इक्वेशंस ही रहती थी. एंड देन ही हैड अ नेमेसिस का क्या मतलब होता है कि समवन हु इज सिमिलर इन कैरेक्टर्स बट इज एक्चुअली इविल, इज एक्चुअली ऑपोजिट इन अ लॉट ऑफ एस्पेक्ट्स. ठीक है, सेम मिट्टी के बने हैं, सेम थॉट प्रोसेस है, बट एक दूसरे से नफरत करते हैं, एक दूसरे को काटते हैं. ठीक है, सो दैट इज अबाउट मैन डार्क. सो दीज आर टू कैरेक्टर्स हियर. जॉनी ब्रावो, रिमेंबर द कीवर्ड इज फ्लेक्स. The keyword here should be nemesis or opposition. All right. So now let's talk about the story of these cartoon characters. It is about two families. First of all, what are adrenergic receptors? You should know about adrenergic receptors that all of these receptors are GPCRs. Now I'll take a new slide and I'll tell you a little bit about what I mean by everything here. So adrenergic receptors, all of these are essentially G protein coupled receptors. Now what are G protein coupled receptors? You will have to study that in detail. What are G protein coupled receptors? Basically these are 7 transmembrane receptors. 7 means they cross the membrane 7 times. Okay, ऐसे करके होते हैं. And then they have some elements attached here, G alpha, G beta, G gamma. ये subunits होते हैं यहाँ पे. ठीक है. I'm not going into the details of what a G protein coupled receptor is, but you should know that adrenergic receptors are G protein coupled receptors. Now, what do you mean by adrenergic receptors? That is that they respond to your epinephrine, norepinephrine, they basically respond to adrenaline and noradrenaline. Okay. Now we will talk about which responds to which more, alpha responds to which, beta responds to which. Okay, and that is having some application for your blood pressure and everything also. Okay, so this is about what are adrenergic receptors. Adrenergic means that they respond to adrenergic neurotransmitters or adrenergic hormones, essentially neurotransmitters here. And you talk about this, some are sensitive, more sensitive to epinephrine, some are more sensitive to norepinephrine. Okay, and that is how there are seven pass transmembrane receptors, so they cross the membrane 7 times. They have some subunits G alpha, G beta, G gamma. Okay, and based on that we have three kinds of GPCRs. Based on that we have three kinds of GPCRs based on their alpha subunits, right? So G alpha, you have G alpha Q, you have G alpha S, you have G alpha I. ठीक है, अभी बताता हूँ what are all of these. But you should have a basic understanding of what are adrenergic receptors. Then there are two types of adrenergic receptors, alpha and beta. Remember, beta mein I have written only three, but in alpha beta there are many more kinds of these receptors, but these are the main important ones. These five receptors and the functions that I have written, they are the main functions that you need to know, and they are the main receptors that you need to know. ठीक है, मोटा मोटा अल्फा बीटा है. अल्फा में भी then you have alpha 1 alpha 2, बीटा में you have beta 1 beta 2 beta 3, and their functions are very different from each other. That is why alpha 1 है कि alpha 2 है, उस बात से बहुत फर्क है, because these are definitely different kinds of receptors. Alpha 1 alpha 2 beta 1 beta 2 beta 3, these are different, and there are 5 cartoon characters, and with the help of these cartoon characters we'll be remembering everything. So now we have come to Johnny Bravo. Johnny Bravo loves to flex. ठीक है, पप्पू मस्कुलर, पॉपुलर, स्पेक्टेकुलर. ठीक है, तो अल्फा 1 जो है अल्फा फैमिली से स्टार्ट करेंगे, बीटा फैमिली की बात नहीं कर रहे हैं अभी, अल्फा फैमिली की बात कर रहे हैं. अल्फा फैमिली, अल्फा मींस यू नो व्हाट इज एन अल्फा. एन अल्फा इज अ वेरी पावरफुल मेंबर ऑफ द कम्युनिटी, राइट. ठीक है, ऐसा कहता है ना कि अल्फा मेल से सारी फीमेल्स अट्रैक्ट होती हैं. ठीक है, सो दैट इज द कॉन्सेप्ट ऑफ अल्फा, एंड अ बीटा इज समवन हु इज मोर सबमिसिव. ठीक है, ये बेसिकली जो एनिमल सोसाइटीज होती है उसमें कॉन्सेप्ट होता है ना, देयर इज एन अल्फा लायन एंड देन द अदर्स आर बीटास. ठीक है, तो अल्फा 1 इज द रियल अल्फा. रियल अल्फा मतलब यही असली अल्फा मेल है. ठीक है, असली अल्फा मेल है, एंड as I already told you, because he is very muscular, he loves to flex, and because he loves to flex, he has to contract his muscles, and contraction of muscles takes calcium, so he loves calcium, right? So that is Johnny Bravo. He's the real alpha who loves to flex, and flexion is muscle contraction, and muscle contraction requires calcium. So now all the functions here, they are related to the contraction of some muscles. All the functions of alpha 1 receptor, they are related to the contraction of some muscle. First function, let's talk about the first function, alpha 1 receptor. What it will do is, it will contract the vascular smooth muscle. So if this is your blood vessel, there is smooth muscle in the walls of this blood vessel, and its contraction will cause, it will cause vasoconstriction. It will cause vasoconstriction, and when that happens, when vasoconstriction occurs, the resistance in the peripheral arteries, those will increase. The arteriolar peripheral resistance will increase. So the peripheral resistance increases, and since the peripheral resistance increases, there is more resistance to blood flow, which will increase the blood pressure. That will increase the blood pressure. So contraction of vascular smooth muscle is the main function, and with that you can remember three functions. First, causes vasoconstriction. Second, causes increase in peripheral vascular resistance. Causes an increase in blood pressure. Now you know the functions of alpha 1, right? Second, contraction of radial muscle. Contraction of radial muscle, right? So I hope you know what is meiosis and what is mydriasis, right? So contraction of these muscles here, it will lead to opening of the eye. Remember sympathetic nervous system, whenever you saw something scary, you wanted to gather more visual input. So your pupil had to dilate. So it causes that constriction, and it causes, so basically, if this is your pupil and these are the radial muscles attached like this, so they will contract here, they will contract here, right? And because of the contraction of these muscles, this pupil dilates, right? So that is the fourth function, mydriasis. It causes mydriasis by the contraction of radial muscles, which is the dilation of the pupil. Then fifth function, it causes the contraction of the internal sphincter. It causes the contraction of the internal sphincter. So that contraction, what will that cause? That will prevent your urination. That will prevent your urination. Similarly, prevents defecation by contracting the internal sphincter, causes the contraction of the internal sphincter, right? Then sixth function, it causes the contraction of vas deferens. Remember that sympathetic nervous system, one of the functions of you used to write this differentiation, function of SNS, function of PSNS. 11th 12th May, PSNS function was erection, function of SNS was ejaculation, and contraction of ejaculation will occur with the occurrence of ejaculation will be with the contraction of vas deferens, So here the sixth point here is going to be contraction of vas deferens, which causes, right here, prevents urination. Happy Navratri, Sanjay. And this function will be ejaculation. Now the seventh function is going to be related to the contraction of the erector pili. It will be related to the contraction of the seventh function. The seventh. Okay, so the seventh function here is related to the contraction of the erector pili, and erector pili muscles, when they contract, you will have piloerection. That is the erection of hair here. So piloerection, that is basically, your sympathetic stimulation. It causes goosebumps. So that is the contraction of the erector pili muscle. It causes goosebumps. So piloerection is another function. In pregnant females, it causes the contractions of the uterus. So now, can you remember all these 8 functions based on a simple thing, that alpha 1 is the real alpha. Real alpha is Johnny Bravo. Johnny Bravo is muscular. Muscular, he likes to flex. So he loves calcium. And because there is contraction, you can think of all the muscles: vascular smooth muscle, radial muscle, internal sphincter muscle, vas deferens, erector pili, and uterus. And then you can write down all these 8 functions which are related to the contraction of various muscles. Okay. First, tell me, is this concept clear related to the alpha 1 receptor? Okay. Now I have told you how to memorize this. Now, just for 2 minutes, I will go into the concept of why this is happening. Why alpha 1 is related to calcium? Why is it related to muscle contraction? Okay. Alpha 1, remember, it is a GPCR. Is a GPCR. The alpha subunit here is of type GQ. Okay, so like I already told you, there are three types. GQ, GS, and GI, right? So mota the functions here. GQ is responsible for an increase in calcium. GS receptor is responsible for an increase in the cyclic AMP levels, camp levels, and GI, it brings down an inhibition in the camp levels. क्या मोटा ये एक प्रिंसिपल है that GQ कैल्शियम बढ़ाता है, GS कैंप बढ़ाता है, और GI कैंप घटाता है. ठीक है, ये 3 बातें very important, very important from your biochemistry point of view, from your receptors point of view. ठीक है, तो alpha 1 receptor is a GQ receptor. Alpha 1 receptor is a GQ receptor. Since it is a GQ receptor, it increases the amount of calcium in cells. That is why our Johnny Bravo trick fits here with respect to alpha 1 receptor, and that is why alpha 1 is Tony Bravo. This much is clear. Please write yes in the chat if you have understood alpha 1 receptor. If you have understood alpha 1 receptors, then I'm going to move on to alpha 2 receptors. My alpha 1 receptors. Okay, so mydriasis means eye muscles. No, we're not talking about the ciliary muscles here. We are talking about the muscles that are responsible for the dilation of the pupil. Ciliary muscles, they are related to the lens. Alright, here we are talking about RM. Here is the radial muscle. RM here is the radial muscle. Alright, so that is what we are talking about. That are responsible for the. Okay, so Shraddha Sharma has written yes, sir. So with that, I will move on. Alright, here. Anybody tell me for how much time have I been streaming? I can't somehow access the. That are responsible for. Okay, great. So let's move to Alpha 2. Alpha 2, which was the cartoon character? Can you remind me which cartoon character was this? This was Mandark. This was Mandark. So he is the nemesis of Dexter. He is the nemesis. Nemesis है तो ये काम करेगा थोड़े से उल्टे. Alright? Because it is a nemesis, so it will do kind of opposite functions. It will be doing something that is different. That is different. Alright? So what it does here is it is the alpha 2 receptor, so it is the second alpha. It is the second alpha. It is second, so it is the nemesis. It is the nemesis. So what does it say? It says calcium is bad, camp is bad, alpha 1 is bad. All of these three things are bad. So what it does is it works through the GI mechanism. It works through the GI mechanism. It is also a GPCR of which kind? The G inhibitory kind. Okay, like I already told you, there are three kinds of these. And the GI, it will obviously mean that it is G inhibitory. And since it is inhibitory, that would mean that it will decrease the camp levels. Now you can think of all of these functions. Since it has to inhibit, it will inhibit neurotransmitter release. It inhibits neurotransmitter release. Why? Because what is required for neurotransmitter release? Calcium. Okay. Neurotransmitter release requires calcium. So it affects that mechanism of release of neurotransmitters and it does not allow the release of neurotransmitters. Okay. First thing. I hope you are able to read this. Here I have written norepinephrine. Here I have written acetylcholine. Second thing it inhibits is insulin. It inhibits the release of insulin. Why? And it promotes the release of glucagon. Why? Because it decreases the camp levels. And a decrease in camp levels is a stimulus for increase in glucagon and a stimulus for decrease in insulin levels. So insulin release occurs when camp levels rise. That promotes the release of insulin. Right? But here the insulin release is not. So remember here that alpha 2 receptors represents that it is the second alpha. So it is jealous of alpha 1. So it will say that calcium and camp are bad, alpha 1 is bad, and it will be having an inhibitory function. Since it has an inhibitory function, it will inhibit two things. One, you have to remember that it will inhibit neurotransmitter release, norepinephrine and acetylcholine. Second thing you have to remember is that it inhibits insulin. And since it is a G inhibitory receptor, how does it do that? It does that by decreasing the camp levels, which promotes the release of glucagon and suppresses the release of insulin. I hope this concept is crystal. Things one. Okay, please write if you have understood alpha 2 receptors, and then let's summarize the alpha 1 family. Let's summarize the alpha 1 family, where mainly you have to remember, let's summarize the alpha family, where you have two kinds of receptors, alpha 1 and alpha 2. अभी बीटा 1 बीटा 2 करेंगे तो और मजा आएगा, ठीक है. Alpha 1, I hope you have understood. Beta 1 beta 2 very important to remember, because beta 1 beta 2 are very confusing. Okay, and that is where these cartoons will help you a lot. बीटा 1 बीटा 2 करेंगे तो और. Let me make sure that is going on. So let's move to beta. Let's move to beta. There are no doubts. So remember the beta family here. The beta family here. It has these. Okay. ये कुछ गड़बड़ है क्या यहाँ पे? Beta family here. So remember the beta family. Beta family, it does not really like the alpha family, because the alphas, see, the alphas, they are very famous, they are very popular, right? They are very famous, very popular. But the betas, they are secondary people. Okay, so like I told you, alphas, they are the ones that all the female want. So betas, they are a very varied group. Some of them want to fight the alpha, some of them are fine with being a beta. Okay, so beta, you have three cartoon characters here. I hope you can recognize this orange t-shirt person. You can recognize who this is, and you can recognize who this is. Can anybody name all these three cartoon characters? Can anybody name all these cartoon characters? No? Yes? No? Maybe can. Name whichever you know, right? It's not a very difficult question. Should not take you so much time. Okay, right. So this is Mr. Bean. This is obviously Mr. Bean. Bean के spelling यही होते हैं. This is Mr. Bean, and I hope you can recognize this character here. That is, yes, this is Boss Baby. Right here, this is Boss Baby, and this is Boss Baby. And what is left here? The first cartoon character that is left here is from your Doraemon series, and that is Jian. मैं हूँ एक उड़ता robot Doraemon, right? So these are three cartoon characters: Jian, Mr. Bean, and Boss Baby. So these three are members of the Beta family. Now very important to revise कि Alpha family के सदस्य कौन है और Beta family के सदस्य कौन है. Alpha, Beta. So Alpha you had Johnny Bravo, मोटा वाला जियान, ठीक है, वो मोटा वाला, एंड देन यू हैड मैंडाक, ठीक है. तो यहाँ पे जॉनी ब्रावो और मैंडाक, ये दो कार्टून कैरेक्टर्स आए थे, विच वाज अल्फा 1 ये था, अल्फा 2 ये है. बीटा फैमिली यू हैव थ्री कैरेक्टर्स अगेन, मिस्टर बीन, राइट, देन बॉस बेबी, बॉस बेबी सबसे छोटा है, ठीक है, बॉस बेबी का फंक्शन भी एक ही है, मिस्टर बीन एंड देन यू हैव जियान। जियान है बीटा 1, मिस्टर बीन है बीटा 2, बॉस बेबी तो बच्चा है तो ऑब्वियसली है बीटा 3। ठीक है, तो पहले तो ये चीज याद रख लो कि कौन सी फैमिली का मेंबर कौन है, राइट। फर्स्ट थिंग दैट यू कैन रिमेंबर फॉर योर ओन कन्वीनियंस इज दैट विच हु इज मेंबर ऑफ विच फैमिली। ठीक है, ये तो रही पहली बात। अब उसके बाद लेट्स मूव ऑन टू बीटा 1, लेट्स मूव ऑन टू बीटा 1। So beta 1 here is obviously your cartoon character, that is Jian. And as you remember from the series Doraemon, that Jian is a very impulsive person, right? Jian is a very impulsive person. जिसको जो मन में आता है कर देता है, जिसको मारना होता है मार देता है, ठीक है, बहुत मतलब impulsive character है, right? Since it is an impulsive character, it always thinks with his heart, right? It always thinks with his heart. He always thinks with his. So that is the first thing that you remember, that beta 1 thinks with his heart. Alright, ये भी काम आएगा. Second thing, since he is beta 1, since he is the first beta, alright, ये alpha बनने ही वाला था, बनते बनते रह गया. So he is always angry and jealous of alpha. Alright, he is always angry, always jealous, एकदम मतलब लाल लाल. Alright, you can make out from his face how red he is. Okay, that is, he is always angry, he is always jealous of alpha. That is the second thing that you have to do. Third thing, he is always tense, tension में रहता है यार, alpha को मैं कैसे मारूं, alpha की कैसे मारूं. So that is why beta 1 is always tense, always angry, always jealous and thinks with the right. Third thing, so now always thinks with the heart. So since he always thinks with the heart, there has to be something related to the heart occurs when beta 1 receptor is stimulated. हार्ट पे तुम ज्यादा जोर डालोगे तो हार्ट का क्या होगा, सब कुछ बढ़ जाएगा. ऑलराइट, इंक्रीज एवरीथिंग, इंक्रीज एवरीथिंग. Since he always needs to fight, always angry, and always thinks with his heart, he has to increase everything related to his heart. So he increases his heart rate. Alright, increases his heart rate, increases contractility of the heart, increases conduction velocity of the heart, increases the cardiac output. ठीक है, सब बढ़ा देता है, हार्ट रेट, कॉन्ट्रैक्टिलिटी, कंडक्शन, कार्डियक आउटपुट. ठीक है, ये तीनों चीजें सी से है, ये एच से है. ठीक है, इसको भी क्रोनिसिटी लिख दोगे तो ये भी सी से हो जाएगा. ठीक है, तो हार्ट रेट, कंडक्शन, कॉन्ट्रैक्टिलिटी एंड कार्डियक आउटपुट, इट इंक्रीजेस एवरीथिंग. बट इवन आफ्टर ऑल ऑफ दिस, इसको अभी भी चैन नहीं पड़ रहा है. ही स्टिल वेरी एंग्री, ही वांट्स टू इंक्रीज हिज बीपी इवन मोर, ही वांट्स टू गेट इवन मोर एंग्री. सो टू इंक्रीज हिज ब्लड प्रेशर, he does one more thing. He activates the renin, angiotensin, aldosterone system. Remember, renin RAS system जो होता है वो BP बढ़ाता है by increasing reabsorption of fluid with the help of both angiotensin and aldosterone. And angiotensin is a very powerful vasoconstrictor. So what he does is, to increase his blood pressure even more, he activates the renin mechanism. He activates renin, so it increases the increase in renin. This point you will find very useful when you study your renal system. रीनल सिस्टम पढ़ोगे या फिर हार्मोन्स वाला सिस्टम पढ़ोगे, उसमें यू विल रीड दैट रिलीज ऑफ रेनिन इज स्टिमुलेटेड बाय, वेरी सिंपल आंसर, बीटा 1 रिसेप्टर. क्यों? क्योंकि जियान को अपना ब्लड प्रेशर और बढ़ाना था, तो उसने बीटा 1 रिसेप्टर, क्योंकि वो है, तो उसने क्या किया, रेनिन का रिलीज कराया. ठीक है, अब इतना सब कर लिया तो लगेगी भूख. ठीक है, अब ऑलरेडी इतना मोटा है और खाना तो खा नहीं सकता, फैट स्टोर करके रखा हुआ है ना, फैट स्टोर करके रखा हुआ है. सो दैट इज व्हाई he wants some monomers. He said that I will break my own fat, I will cause lipolysis, and by that lipolysis I will get free fatty acid. अब ये free fatty acid फिर again he is doing for his own heart, because free fatty acid can be utilized by heart as a source of energy, right? So answer here, another function is going to be lipolysis. So what are all the functions I've told you? Increases heart rate, increases contractility, increases conduction, increases cardiac output. To further increase blood pressure, causes an increase in renin, and to get monomers, especially that the heart can utilize free fatty acids. Again, he is doing it for his heart. He causes a increased lipolysis. So these are the 6 functions of beta 1 receptors that you can easily remember if you just remember that beta 1 family में पहला beta जो है जियान almost alpha बनने वाला था, but because he was not an alpha, he's always angry, always jealous of alpha, keeps thinking with his heart, is very impulsive and is always tense. There are all of these functions: an increase in heart rate, increase in contractility, increase in conduction, increase in cardiac output to increase the BP further, causes an increase in renin, also causes an increase in the lipolysis. He wants monomers to fight alpha, and those monomers will also be utilized by the heart because the heart has the capacity to directly utilize free fatty acids. Sorry. Yeah. If you have understood beta 1 and if you have liked this explanation, this correlation of the beta 1 receptor with this cartoon, do let me know in the chat box. And at the end of this video, please try to drop a comment if possible in the chat box because that will remain as a record. Yeah, just let me know that you find all of this. Write a yes in the chat box if possible. Yeah, just let. Okay, Shraddha has written a yes. Okay. Beta 1 पूरा समझ आ गया होगा फिर. I assume. So if there's no more confusions, let's move to beta 2 in another minute. So beta 2, remember, beta 2 is the cool, calm brother. Okay. Jian was a very angry person, a very impulsive person. Okay. But beta 2 को पता था भाई मैंने तो बीटा ही बनना है, मुझे अल्फा बनने का कोई शौक नहीं है. He is a very cool, very calm, very relaxed brother, right? Always tells beta 1, breathe, breathe, relax, relax. That is what beta 2 tells beta 1. That you have to be cool, you have to be calm, for that you have to breathe, for that you have to relax, right? You have to do two things. You have to breathe, you have to relax. Stay calm, for that you have to do two things. One, you have to breathe, second, you have to relax. So breathe will cause bronchodilation. Dilate your bronchioles, let the air flow in. Okay, so bronchodilation is Mr. Bean. Mr. Bean, you can also say here that Mr. Bean is a very cool, very calm character, right? बड़ा हंसी मजाक वाला कैरेक्टर है. आराम से चिल करना है अपने को, ठीक है. कोई लड़ना नहीं है, चिल करना है, चिल, ठीक है, चिल करना है. तो चिल करने के लिए क्या करेंगे? ब्रोंकोडाइलेशन. ऑलराइट. Then second thing it causes is relaxation. So relaxation करेगा, so what it causes? Vasodilation. It causes vasodilation, right? Causes relaxation of vascular smooth muscle, which is why it also causes vasodilation. It also causes vasodilation. Then the third thing it does is that because it causes vasodilation, it will slightly decrease your peripheral resistance. Remember alpha 1. Alpha 1 caused the release of calcium, because of which it causes an increase in the vascular resistance. Whereas beta 2 has the opposite effect. It causes a slight decrease in the peripheral vascular resistance. Alpha 1 was contracting the uterus. Beta 2, it is causing relaxation. So for a female, it will say relax the uterus. ठीक है, सब relax कर दो, breathe करो, relax करो, chill करो. ठीक है, तो बीटा यहाँ पे relaxes the uterus. So what are the four functions you have to remember? Importantly you have to remember here. तो दो functions बड़े important है remember करने. वो ये है वेजोडाइलेशन और ब्रोंकोडाइलेशन. ठीक है, ये दो तो बहुत इंपॉर्टेंट फंक्शंस है, वेजोडाइलेशन एंड ब्रोंकोडाइलेशन. के अलावा वेजोडाइलेशन इट इज ऑब्वियसली रिलेटेड टू स्लाइट डिक्रीज इन द पेरिफेरल रेजिस्टेंस एंड आल्सो कॉजेस अ रिलैक्सेशन इन द यूट्रस. नाउ सम फंक्शंस दैट यू शुड नो इज दैट even though beta 2 always tells beta 1 to relay remain calm, right? uh, Beta 2 still is very intelligent. Beta 2 keeps telling beta 1 that if you fight I will still help you, right? So it wants to be prepared if beta 1 takes on a fight with alpha. मिर्जापुर देखे हो? ठीक है, मैंने कल ही मिर्जापुर का सीजन 1 पूरा खत्म किया, इसीलिए अभी मिर्जापुर के एग्जांपल दे रहा हूँ. ठीक है, मिर्जापुर में क्या होता है, यू कैन ऑल्सो इफ यू डोंट वांट टू रिलेट दिस टू अ कार्टून कैरेक्टर यू कैन रिलेट दिस टू गुड्डू बबलू. ऑलराइट, बीटा 1 is गुड्डू, गुड्डू भैया from मिर्जापुर. You watched मिर्जापुर. And beta 2 is क्या, मिर्जापुर. इसका सीजन 2 भी आ रहा है अब. तो दिस इज व्हाट यू शुड नो कि गुड्डू भैया का क्या होता था उसमें. ही वाज वेरी एंग्री, यूज्ड टू कॉन्स्टेंटली बी इन एन एंगर स्टेट. ठीक है, एंड बिकॉज ऑफ दैट एंगर स्टेट ही यूज्ड टू contract, he used to keep flexing his muscle. And beta 2 Bablu was relatively calm, he was relatively relaxed. Bronchodilation vasodilation थी उसकी. Okay, but he was also prepared always for a fight with, if beta 1 took a fight with alpha now. So he also prepares his monomers. So what he does is he causes the breakdown of glycogen. So fifth function is glycogenolysis. ग्लाइकोजिनोलाइसिस के लिए कौन सा हार्मोन चाहिए, ग्लूकागॉन, बिकॉज इट इंक्रीजेस द ब्लड ग्लूकोज लेवल. सो इट विल आल्सो कॉज एन इंक्रीज इन द ग्लूकागॉन लेवल्स. सेवेंथ थिंग इट डज इज इट कॉजेस an increase in the muscle. So it basically does your anabolism. It has an anabolic action. As an anabolic action. So remember all of these receptors. I have not gone into the detailed mechanism of these receptors, but here I want to point out that beta 1, beta 2, beta 3, all of these receptors, just give me a minute, chat here, बंद हो गई है. So essentially your beta 1, beta 2, beta 3, all of these are working with the GS mechanism. They are working with the GS mechanism, and GS mechanism was an increase in the camp levels, an increase in the camp levels, right? So remember this three things. So alpha 1, alpha 2, beta 1, beta 2, beta 3. So now to summarize their functions, you have to remember that this is GQ, this is GI, this is GS, this is GS, this is GS. Remember GS, they will increase the camp levels. They will increase the camp levels. This will decrease the camp levels, and GQ will increase the calcium levels. So this is how you can kind of relate their functions. This is how you can relate their functions with a logical understanding. But logic नहीं लगाना है, तो very simple. Write this as Johnny Bravo. Write this as Mandark. Beta 1 write this as Gian. Beta 2 write this as Mr. Bean. And beta 3 write this as Boss Baby. And if you like Mirzapur, you can also write this as Guddu Bhaiya. You can write this as Bhaiya. ठीक है, ये हो गया यहाँ की कहानी. अब चलते हैं, बीटा 2 के फंक्शंस पूरे हो गए, अब रह गया बीटा 3. ऑलराइट, नाउ बीटा 3 इज बेसिकली योर बॉस बेबी. ठीक है, अब बॉस बेबी का क्या सीन है. बॉस बेबी को पता है दैट हिज ब्रदर्स आर गोइंग टू फाइट. ही नोज दैट हिज ब्रदर्स आर गोइंग टू फाइट. So beta 3 is the baby brother. He is chubby chubby cute cute. ठीक है, कैसा है वो? Chubby chubby cute cute. And because of that he has a lot of brown fat. Babies, as you know, they have brown fat. Now he wants to contribute his own little way to his fight. So he says that चलो बीटा वन भैया को फ्री फैटी एसिड बहुत पसंद है, उनका हार्ट यूटिलाइज करता है, तो मैं भी लाइपोलाइसिस तो कर ही दूंगा. Alright, because I have brown fat, I cannot file it, but I have brown fat, so I can still produce energy, I can still produce heat. So beta 3 receptors, their main function, they have only one function, that is lipolysis mainly of brown fat. चबी चबी क्यूट क्यूट. ठीक है, तो ये हो गया मिस्टर बीन, ये हो गए आपके बॉस बेबी. इसके साथ वी हैव रीच्ड द एंड ऑफ द फंक्शंस, द एक्सप्लेनेशन ऑफ ऑल दीज फंक्शंस. वी विल डू अ क्विक recap after this, and after that we'll be ending the video. ठीक है, so let's start with the summary. And at 50 minutes, okay, I'll just type this in the chat. 4:50 is where the recap starts. I'll also put this in the comment section. And if you guys like this video, I would really appreciate it that जैसे ही ये stream खत्म हो, ये video save हो, तुम comments में कुछ अच्छा सा लिख देना, ठीक है? So the first thing that you have to remember here, adrenergic receptors. First of all, I want you to remember the names of all the cartoon characters that we've talked about so far. I will take a very prominent ink color. Let's take this. So this is Johnny Bravo. Alright. This is Man Dark. This is Gian. This is Mr. Bean. And this is Boss Baby. Yeah. First of all, you should be remembering these five cartoon characters. Very easy to remember. Where if you can create this visualization in your head. Johnny Bravo, Alpha 1, Real Alpha, and Dark Nemesis, Alpha 2, Beta 1, Angry, Gian, Beta 2, Relaxed, Mr. Bean, Beta 3, Acha, Boss Baby. Then you can also, if you like Mirzapur, you can also write here Guddu Bhaiya. And here, instead of Mr. Bean, you can use Bablu Bhaiya, whatever you want to use. Yeah, that is what you want to use. Okay, then next thing that you have to know is the alpha family and the beta family. So now we have created this alpha versus beta. Alpha 1, and now all of these are G protein coupled receptors. So what you should know is alpha 1 is GQ, alpha 2 is GI, beta 1 is GS, beta 2 is also GS, beta 3 is also GS. This will cause a increase in calcium. This will cause a decrease in the CAMP, and all these three will increase the CAMP levels. Will increase the. That is how you have to logically correlate. Now, why is this topic important? This topic is important from both physio and pharma perspective, even from your medicine perspective, especially pharma where you have selective alpha and beta blockers. So alpha 1, real alpha, Johnny Bravo is the real alpha, muscular, spectacular, popular, loves to flex. Flexion is muscular contraction, so it causes release of calcium. So wherever you can contract a muscle, contract that muscle, you will be able to write the 8 functions here. Contraction of vascular smooth muscle causes vasoconstriction, increase in peripheral vascular resistance, increase in blood pressure. Contraction of the radial muscles of the iris causes a dilation of the pupil, that is known as mydriasis. Contraction of the internal sphincter causes prevention of urination. Contraction of the vas deferens is same as ejaculation, and contraction of the erector pillae is piloerection. Contraction of the uterus of a pregnant female is also another function of the alpha 1 receptor. Second thing, alpha 2, the second alpha, दूसरा alpha, ठीक है? And since he is the second alpha, he is a nemesis. Mandark is the nemesis of Dexter in the series Dexter. So he does opposite thing, and he says calcium is bad, CAMP is bad, alpha 1 is bad, and since it decreases the CAMP levels, it is G inhibitory. Since it is inhibitory, it will be inhibiting functions. Okay, so first thing that it inhibits is the neurotransmitter release, that is the release of norepinephrine and acetylcholine. Second thing it inhibits the release of insulin. All right, next let's come to beta 1. Beta 1, beta family, Beta 1 was almost about to become an alpha. He's very jealous, he's very angry of the alpha, he wants to fight. So the beta and the alpha, they have this fight, and beta 1 wants to fight very much. He always thinks with his heart, very impulsive, always tense. Always thinks with his heart, so a lot of the functions are related to the heart. It increases everything related to the heart, increases heart rate, increases contractility, increases conduction, increases cardiac output. बट इतने से भी उसका दिल नहीं भरता, इसको और अपना बीपी बढ़ाना है, और बीपी बढ़ाने के लिए क्या करता है, इट एक्टिवेट्स द रेनिन एंजियोटेंसिन aldosterone system, so it increases the amount of renin release. Very important point, increase in renin is a function of beta 1 receptor. Point number 5, sixth thing, because he's thinking about his heart, he wants monomers to fight, so he will cause lipolysis. By lipolysis, it produces free fatty acids, and these free fatty acids can be utilized directly. Beta 2 is exactly opposite. Beta 2 is very happy with his life. He knows that he is happy being a beta. He tells his brother to be cool, to be calm, and he asks him to breathe. Right? To breathe, to relax. Breathing means bronchodilation. Relaxation means vasodilation. Function number 1 is vasodilation. It will also cause a slight decrease in peripheral vascular resistance. Third function is bronchodilation. Okay, this is relax, relax. This is breathe, breathe. Fourth function, it also causes relaxation of uterus, so it is opposite to alpha 1 here. But it is also very smart, like Bablu Bhaiya from Mirzapur, and he wants to also be prepared with the help of monomers. So he wants to give some raw material to Guddu Bhaiya. So what he gives is he does glycogenolysis so that he can break down glycogen into glucose and get monomers there. So function here is glycogenolysis. Next is the release of glucagon. Sixth is the release of glucagon, because glucagon will also increase the blood glucose levels. Seventh function is it is anabolic in function and will increase the amount of muscle. Beta 3 is the baby brother, chubby chubby, cute cute. He has a lot of brown fat, does not know how to contribute. So what he does is he causes lipolysis. कि चलो बड़े भैया को free fatty acid तो मिल ही जाएगा. These are all the functions of alpha 1, alpha 2, beta 1, beta 2, beta 3, with all the related concepts that you should be knowing. And with this, I have summarized everything that you need to know about the alpha 1, alpha 2, beta 1, beta 2, beta 3 and their functions. And if you know which functions are blocked, you will also be able to correlate this with pharmacology. And that will be summarizing of exactly how you should go about for alpha 1, alpha 2, beta 1, beta 2, beta 3. And ये जो last के 7 minutes है, I would seriously recommend अपने एग्जाम से पहले एक बार ये 7 मिनट दोबारा देख लेना. जो भी जहाँ पे भी कुछ भी करोगे, these 7 minutes will definitely be useful to you. ठीक है? So this is an entire summary slide. Stress here more. I will spend some more time here. ठीक है, तो इफ यू लाइक दिस वीडियो, जैसे ही मैं स्ट्रीम एंड करूंगा, you will have the option to put comments, because then this video will get saved as a normal YouTube video. So please do add some comments there. Hit the like button. If you're hitting the like button, you can also hit the bell icon for notifications after you've subscribed to Unacademy's YouTube channel. Let's Crack NEET PG, India's largest online learning platform. And if you take any plus subscription, do use my referral code Chetanya10. I've already told you that my Telegram channel is @NEET PG Chetanya, where I'll also be sending the PDF of today's presentation. And this is the Telegram channel that you have to join. And this is my Instagram handle @Chetanya.blue. You can follow me there. You can contact me there, right? If you want to take a, especially if you want to take a plus subscription. Just give me a second. Hello. क्या कहाँ से बात कर रहे हैं? हाँ मैं आपको, आप मेरे को 5 मिनट में कॉल करिए. Okay, so this is what is going on here, that you have this so this is my Telegram channel, this is my Instagram handle, and if you take any plus subscription, please do text me there. If you will be using my referral code, you can use this referral code and you will get a 10% discount straight away. And from my side, since you are contacting me, I will give you my own cash back from my end. I've already given this to a lot of users, and with that you will also have, I will also tell you how to use credits. So I would really recommend that right now, if you are in the second year especially, take the Unacademy Iconic subscription, where you will get both Unacademy Plus and Prep Ladder. Okay, don't pay just for Prep Ladder, also get Unacademy Plus, and you can get this for 3 years at a cost of, I will this will come down to 70,000 if you are able to use credits effectively. All right. So that is about today's video. I hope you liked this video and do hit the like button. And that is it for today. I'll be ending the stream. Tomorrow at 4 p.m. we will be doing another class that is nerves of upper limb. We will be doing a class that is nerves of upper limb. Very productive, very high yield class. Do join into this class. Again, nerves of upper limb. You can join my Telegram channel and you can stay updated with whatever classes I'm taking.